Whenever it comes to the stuff in our med bag, we're going to go off the March algorithm. So M stands for massive bleeding. So things like tourniquets, you definitely want a couple of these at a minimum. This is a standard windlass tourniquet where you tighten it down. This is like a, I don't know, cinch tourniquet, or Israeli, I think is what they call that. Works really well for animals, but it also does work good for humans as well. But always put this one on first. You might need a second one depending upon where the person's wounded. Combat gauze. So this is gauze that has clotting seashell like infused into it, and so when you start to pack that wound, it helps to cauterize that bleed. So that's M for massive hemorrhaging. A is for airway. We have a decompression needle if you have a sucking chest wound, which you need to be trained on how to use that. And then we have an occlusive dressing that you just put on top of really any sort of thoracic injury. And then an NPA. This one is for a grown man. The size of these things do matter, so just keep that in mind. So massive hemorrhaging, airway, respirations, which these technically could be also used underneath the respirations aspect of the March algorithm. This would be airway, that would be respirations. And then C for circulation, H for hypothermia. This is just a small little blowout pack, so I'm not going to have necessarily everything in here, but to stop the bleeding and to open up somebody's airway and start to get them to breathe regularly again, I mean, that's, obviously huge, but you do also want to be aware of their circulation and hypothermia, because a lot of people will hype out whenever they do get wounded. I also keep some medical tape, like on an outside portion of this fanny pack here, and then I also have a flashlight, so we could check for anything lodged in the eyes or any sort of head trauma, because then you'll have dilated pupils or non-reactive pupils.